Yes. Suara macam Madeline dah. Oh? Aku nampak. Dah left. Dah left. Oh, ni dah masuk. Nampak aku tak? Tak ada.
Please also ensure that mobile phones are set to silent mode to avoid any disturbances. Lastly, attendees are reminded to stand for the arrival of our VIPs and other guests. We appreciate your cooperation. The ceremony will begin shortly, so please stay tuned and follow any instruction provided. Thank you. We appreciate cooperation. The ceremony will begin shortly, so please stay tuned and follow any instruction provided. Our distinguished guests. All attendees are reminded to remain standing for National Anthem Negaraku, followed by Wawasan Setia Warga UiTM. Thank you for your cooperation. You will now be seated. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Salam UiTM di hatiku dan salam FSG padu. Yang berbahagia, Profesor Dr. Muhammad Rozi Ahmad, Dean Faculty of Applied Science. Yang berbahagia, Chemist Dr. Muhammad Sufri Mastuli, Deputy Dean of Student Affairs, Faculty of Applied Science. Yang berusaha, Dr. Yama Zafir, Chiropractic Specialist, Founder of the Chiropractic Specialty Center. Ms. Nozarihan Binti Zulkifli, Program Director of the Heart Talk Series. Esteemed faculty members, staff, and all guests. I am Nur Asma Atiyah binti Bamin, your MC for this morning, warmly welcoming you to the Heart Talk Sleep Days. Honored guests, to commence our program, let us unite in a moment of prayer. I would like to invite Mr. Shahrul Shazim Shahrul to lead the dua recitation for today. Please welcome.
Bismillahirrahmanirrahim. Alhamdulillahirrahmanirrahim. Wassalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Oh Allah, our Lord, indeed it is our gratitude to you for allowing us together for this the Health Talks Day this event. May this gathering be blessed with your abundant mercy and compassion, and may all our efforts in making this event successful gain your approval and guidance. Oh Allah, the Almighty, who execute all that you do, bless this event of ours in a platform for fostering unity among our members and ease our endeavors as we face challenge in elevating our institution to a greater height. O Allah, the most gracious, the most merciful, we ask you, O Allah, that our meeting today be nurture students who are trustworthy, responsible, and who contribute to the creation of excellent, distinguished, and outstanding society. O Allah, make this gathering one and express and filled in your mercy. And may your departure of the world be safeguarded from harm and misfortune under your protection. Rabbana zalamna anfusana wa in lam taghfir lana wa tarhamna lanakunanna minal khasirin. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina azabannar. Sallallahu ala sayyidina Muhammad wa ala alihi wa sahbihi wa sallam walhamdulillahi rabbil alamin.
Amin, amin, ya Rabbal Alamin. Thank you to Mr. Shahru Shazli for the prayer just now. For everyone's information, the Health Talks with this aims to raise awareness among students and staff regarding the vital role of the spine in maintaining overall health. Additionally, the program will help us identify risk factors that can endanger spinal health and introduce preventive practice and early interventions to reduce the risk of serious injury. Next, this ceremony would like to invite Ms. Nazari Hamida Zulkifli, the Program Director of the Health Talks with this, to say a few words. With great respect, I welcome her to the stage.
Bismillahirrahmanirrahim. In the name of Allah, the most gracious, the most merciful. Thank you, His Master of Ceremony, Yang Berbahagia Prof. Dr. Muhammad Rozi Ahmad, Dean Faculty of Applied Science, Yang Berbahagia Chemist Dr. Muhammad Sufi Maskuni, Deputy Dean of Student Affairs, Faculty of Applied Science, Yang Berusaha Dr. Yaman Safar, Chiropractic Specialist and Founder of Chiropractic Specialty Center, our honored guest, representative from the Chiropractic Specialty Center, faculty lecturers and staff, program organizing committee members, and all beloved guests. Assalamualaikum warahmatullahi wabarakatuh, and warm greetings to all. We are grateful to Almighty Allah for His grace and permission in allowing us to gather this morning for the Health Talks with this program. Esteemed guests, the Health Talks with this is an initiative organized to raise awareness about the risk of diabetes. This program aims to provide comprehensive information on risk factors, symptoms, treatment, and preventive measures related to diabetes. The program includes an interactive forum along with other activities such as demonstration, quizzes, and more. The health team will also be set up at the Faculty of Applied Science foyer by representative from Chiropractic Specialty Center. This program is attended by active students from the Faculty of Applied Science along with participants from UiTM Shah Alam and UiTM branch. The main information sharing session is conducted in hybrid mode with up to 80 in-person participants including staff and students. For online participants, the program will be streamed live on YouTube at the same time as in-person session. For your information, the main goal of this program is to emphasize the importance of spinal health for UiTM staff and students, especially those from Faculty of Applied Science. Additionally, we aim to strengthen connection between student association and health sector body, including UiTM branch campus. The program also seeks to improve students' understanding of the vital role of spinal health plays in overall well-being and help them recognize risk factors that could impact their spine. Lastly, it introduces preventive practice and early intervention to reduce the risk of injury, while also offering participant insight into career in chiropractic and the scope of work in this field. Honored guests, I would like to take this opportunity to congratulate and commend the ASYCC Program Committee for their hard work and dedication in assuring success of this event. I sincerely hope that this program can continue in the future. I also want to apologize to everyone if during my time as a program director, I may have unintentionally hurt anyone's feelings. Truly, any good comes from Allah Subhanahu wa Taala. In any shortcoming, I might do. Lastly, as we part today, I leave you with this verse. May the road rise up to meet you. May the wind be always be at your back. And until we meet again, may Allah hold you in the palm of His hand. Thank you. Wabillahi taufiq wa hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Ms. Nazari Han, for her meaningful speech. The ceremony ceremony now has the honor of invite the Dean of the Faculty of Applied Science, Professor Dr. Muhammad Rozi Ahmad, to deliver his speech and officially inaugurate our program this morning. With the utmost honor, I would like to welcome him to the stage.
Saya bahagia menerima majlis. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning to everyone who are here in this beautiful hall. I seldom read the text, but to honor the person who wrote this text, I have to read some of it. So to our honored guest, Dr. Yama Zafir, who is the chiropractic specialist and founder of the Chiropractic Specialty Center. Thank you for coming, sir. And also the team from the center. Chemist Dr. Masturi, our deputy for student affairs of the faculty. And Ms. Nur Zarikan Zulkifli, who is the program director for this particular talk from the Applied Science Youth Care Crew, or asycc. This particular society, sir, is one of the most active society in the faculty. They had so many activities this last year, and I'm glad that they organized this sort of event, particularly talking about safety. And I think this is close to me because my wife also had this particular problem right now, I guess. And I had once a frozen shoulder, and I had the procedure to fix it. And my wife is having this issue. I know she had to go through the MRI for a few hours and 2 times, and then to detect whether is it a frozen shoulder or back pain, things like that. And she was jabbed once, I think, to ease the pain. And alhamdulillah, it's recovering, but it comes, afterward it comes again. So what she's doing now is to do some light exercises, particularly in the morning before she goes to work, and I think that is the problem. And sometimes I had to massage her, gentle massage, and also had to put the I don't know what it's called, some ointment. Yeah, that's the ointment on at the back. So I guess this is not new to me, and from that, if we had that problems, sometimes it's good to read here and there, try to scan what are the issues leading to sleep this. And what else? So I want to say my thanks to the society for organizing this event, and I was hoping to have hoping to have this room crowded with students, also the staff, probably because of the Diwali holiday yesterday. Some of them probably that, I don't know. But thank you for coming, Dr. Yama, and thank you for your time. And you spoke to me that probably it's also good to have a talk on sleep, especially for the students. So probably sleep disorders, something like that, and the importance of sleep, I guess. Probably we can also invite Dr. Yama the next time to talk about sleep or sleeping, which is also an important topic, because as students probably you have less sleeping time, isn't it? Yeah. Because of your assignments and things like that. So probably sleep is also a very good issue, very close to you. So I think without further delay, I would like to welcome Dr. Yama once again, and thank you to the society for organizing this event, and hopefully everyone will have a good time. I'm sorry I can't stay long because I have another event to attend, and hopefully that all the students here who are here present here, so I think it's in YouTube, I guess. Is it in YouTube? Okay, good. So probably good to advertise this particular. We have a forum, I guess. Is it a forum-based program? Yeah, it's a forum-based program. Yeah, that's good. So please advertise this program and put it on YouTube and make sure that all our staff and students just have some info on the program. Right? So I think that's all from me. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Our heartfelt thanks to Professor Dr. Muhammad Rozi Ahmad for his kind words. Without further delay, this ceremony respectfully invites our honored panelist Dr. Yama Zafi, along with our moderator Mr. Ahmad Kashful, to the forum stage for the next segment. Thus, we shall proceed with Mr. Ahmad Kashful Asfar, who will lead this morning's forum. It's my pleasure to invite them to the stage.
Can everyone hear me? Am I talking too low? A little louder? I have no problem going loud. Okay, good.
Thank you, our respectful MC. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera, salam UiTM di hatiku, and salam FNC padu to our distinguished panels and the audience. I am Ahmad Kashful Asfar Abdul Rahman, your moderator for today's forum. I would like to welcome the audience and those who are watching on YouTube channel to our forum, the Health Talks like this. How's you guys? Today? Okay. Tak kenal maka tak cinta, right? So before we continue to our forum, I would like to introduce our panels today. Dr. Yama Zafir from Chiropractic Specialty Center, right, Doctor?
Correct.
Yes, Doctor.
Waalaikumsalam warahmatullahi wabarakatuh.
Okay, Alhamdulillah. It's a pleasure to hear. Okay. Doctor, thank you for being with us today despite your busy schedule.
Thank you for having me. Pleasure to be here with everyone.
I think everyone is eager to get to know about you. So I think it's proper to me to introduce you first.
Okay. Well,
Okay. Alright. A little bit of an introduction to Dr. Yama Zafi. Dr. Yama started as a chiropractic doctor at Zafi Chiropractic and Sport Injuries Clinic in the United States of America in 1996. Thank you. Okay, later on, he was appointed to be the director of Zafi Chiropractic Health Clinic, also in the state, in 1997, before immigrating to Malaysia in 2006. He is now the founder and the director of the Chiropractic Specialty Center, Sedian Berhad, established in 2006. He is actively doing research, study and development, focusing on invasive musculoskeletal treatment technique. Right, Doctor? He is a highly esteemed chiropractic physician that specializes in spinal disc disorder and sport injuries. Wow! I'm personally amazed with your experience and reputation, Doctor. I think the audience too, right? So let us give a round of applause to Dr. Yama Zafi. Okay, Doctor. And now we can continue to our forum, the Health Talks CP. So before we going to discuss the main topic, I would like to ask you, what is chiropractic?
Good question. Chiropractic is a branch of healthcare that deals with neuromusculoskeletal disorders. That's a big word. That means anything that has to do with nerves, nervous system, muscles, ligaments, and joints. It is now 130 years ago. It was first founded in Davenport, Iowa in 1895 by Daniel Palmer, who was the first chiropractor, and it has grown since. Daniel Palmer was not a physician, he was a naturalist, he was a well-educated man, and he was studied Whole Foods. And he continued his research as a layman. Back then, education was limited. So although he did not have formal training, he continued on learning on his own, and he said to have had one of the most in-depth libraries at this time in the United States. He was not American by birth. He was a Canadian that immigrated to the United States. And after discovering chiropractic, or what is known now chiropractic by accident, he started to teach the similar methods to his peers, or to those who wanted to learn. And ever since, chiropractic flourished. Today, chiropractors practice in all countries. Although it started in the United States, still the vast majority of chiropractors practice in the United States. But it's expanding fast. It is one of the fastest expanding branches of healthcare. And what makes chiropractic so appealing to all is its non-invasive, holistic nature. In other words, we, as chiropractors, crack musculoskeletal problems, disorders, and injuries without the use of medication, injections, or surgery. Although some within my profession are thoroughly opposed to medication and surgeries, I am not. I do believe that healthcare should be integrative and holistic, meaning that there is no silver bullets in anything. In order for you to recover, whether it is musculoskeletal or a disease or an infection or a pathological process, you need approaches from different principles. It has to be holistic. It has to be a teamwork, team effort. And I am a firm believer in that, and I have practiced that way ever since my first day in chiropractic. And inshallah, I will continue to do that if Allah allows me.
Okay, thank you, Doctor, for your explanation regarding the chiropractic. So, Doctor, there is a similar healthcare branch which is physiotherapy. Is there any difference between physiotherapy and chiropractic?
There's differences between physiotherapy and chiropractic, but there are a lot of crossovers. There are a lot of similarities. Physiotherapy was founded by a Swedish gymnastic guru, Hans something, I can't recall his name at this moment. This was in the 1920s. And before the 1920s, physiotherapy was performed in hospitals by nurses. So they needed to organize, and they did organize. The Swedish gymnast coach, he organized the profession, which isn't today known as physiotherapy. The difference between physiotherapy and chiropractic is one, educational background, and two, the means through which we do the treatments. We focus more, not solely, but more on proper nervous system stability. We focus more on the function of the spinal cord and brain, where physiotherapists focus more on muscles. But we both need. Your brain and nervous system need your muscles need your brain and nervous system. There is crossovers in every aspect between a physiotherapy and chiropractic. In my centers, we have both physiotherapists and chiropractors working in order to benefit the patient the most. But there are some differences, but minor, generally speaking. Chiropractors, me as a chiropractor, I studied physiotherapy and I passed the physiotherapy board in the US. And in order for a chiropractor in America to practice, they must pass a national board in physiotherapy. So it is part of our education. However, chiropractic is not part of the physiotherapy education program.
Oh, okay. Now we understand what's separate between physiotherapy and chiropractic. So, as Dr. just mentioned just now, physiotherapy more focused on muscle.
Not necessarily. Their origin was more muscle and movement.
Oh, generally.
But it has evolved. Just like the origin of chiropractic was mainly alignment of the spine, it has evolved. And if you look back, the origin of today's medicine was germs, bacteria, but it has evolved.
Oh, okay, now we understand. So, thank you, Doctor, for the explanation regarding what is the difference between chiropractic and physiotherapy. So now let us jump right to our main topic today, the hard top slip disc. Okay, so today's forum focus on common but misunderstood conditions called slip disc. Okay, so today, whether you have a slip disc just now or you are curious, so we now provide a valuable insight for you. Okay, so first, doctor, first and foremost, what is slip disc?
Well, slip disc is actually a layperson term. Discs don't slip, technically speaking, but everybody understands what a slip disc is, but very few understand what an extruded disc is. They're pretty much talking about the same thing, and I am guilty of it too. I use the term slip disc because everybody understands what a slip disc is. But in reality, the actual term for slip disc encompasses 7 different conditions. It's a bulging disc, prolapsed disc, protruded disc, herniated or ruptured disc, extruded disc, fragmented disc, and supraextruded disc, starting from the mildest one to the severest one. Slip disc is a condition where the padding, the cushions between the vertebrae gets damaged over time. Not just over time, it can happen at any age. And with that damage, the disc fibers are predisposed to tears. And that collectively is called a slip disc. And the main reason why it is serious is because it can interfere with your health. Not just back pain or neck pain, but also organs. Because it compresses the nerves, and it can compress the spinal cord, and it can create havoc as far as the flow of nutrients to your brain, the CSF that flows within the spinal canal and the brain.
Doctor, thank you for the explanation. So, Doctor has mentioned before that slip disc is related to 7 conditions. Right? So, one of them is herniated disc. Okay. So, there is a study that I read that show that 80% of people experience back pain, and the portions of that is related to the slip disc. So, what is the risk factor that lead to the slip disc?
The number one cause of slip disc, a disc, the traditional term slip disc will not slip. Disc is very, very, very resilient structures. And in fact, they did an in vivo study, they did a lab test. They wanted to find out how strong is the disc and how much pressure they have to put on top of it before it slips or it herniates. And they took specimen from cadavers. They're human beings that have passed, donated their bodies to science. So they took samples of 2 motion segments. Give me 1 second so I can bring this spinal. I can show you. Makes more sense. We use this little guy. We didn't bring the big one. Hopefully you can see. The spine is divided into sections. We have the cervical in pink, the thoracic in blue, the lumbars in green. In total, there are 24 bones, but only 23 discs. The space between the first bone in your neck and the second bone of your neck does not have a disc. Everything else has it. If you look closely, you can see a little padding. And what I'm going to do is I'm going to pass this around so you guys can all inspect the spine while I talk. Please don't break it. And don't need to chatter with it either. Okay, so, excuse me. The discs attached to the bones above and below. And what they did in this study is they took segments. A motion segment is a vertebra above, a vertebra below, in the disc in between. And that is referred to as a motion segment because in order for you to have motion, movements, you need 2 vertebrae and it's connecting mobile part in between, which is the disc. So what they did is they took several from different cadavers and they kept subjecting it to weight. In other words, they put it in the machine. We'll assume that this is the motion segment, two vertebrae with a disc in between. So what they did is they put them down and they kept applying forces. They wanted to see at what point how much weight will have to come down on top of a healthy disc before that disc herniates or slips. You know what happened? They couldn't figure it out. They kept adding more weight and more weight and more weight. In each instance, not in one or two, in each, in each instance, the bones of the vertebra broke, but the disc didn't give in. So what the researchers said, that the healthy disc is essentially stronger than even bone. A healthy disc will not slip, will not herniate. So if it doesn't herniate and slip, then what happens? Then why do we have, like you said, 80% of the world with back pain? Well, what happens is that the way we're sitting in these chairs, the way we bend and twist, the poor sleeping postures that we have, the axial loading, meaning the loading that comes down, that we subject our bodies to, causes the disc to have increased pressure within. And with that, the disc starts to wear out. It degenerates, dehydrates, it's no longer flexible, it's no longer strong. As with anything in life, anything that wears out is weak. Anything that is degenerated is weak. And what is weak will get injured. So what causes a slip disc is poor sitting postures, bending and twisting. And the main reason why it causes that, because when we sit in bad postures, when we twist and bend the wrong way, our discs wear out. And it's one final moment, one fine day, because of that wear that we have in our bodies, the disc will slip. And someone else did a research. Well, how common then is a degenerated disc? Quite common. They found out, it's published a study, that 20% of kids aged 9 to 11 have degenerated discs. 20% of kids, not even teenagers. Nearly everyone will have some form of degenerations. We all do. Our bodies degenerate. That's a fact of life. We can't stop it. But premature degeneration is not. And it has to happen. So what we need to do to avoid it, sit better, be active, don't gain weight, don't stay in poor posture, sleep more.
Okay, thank you, Doctor. So, Doctor has explained regarding the risk and factor that causes this. One of them is a bad posture. So, guys, stay with a good posture now, so we don't get sleep this. So, let's continue to next question, Doctor. I hope everyone is not tired yet. So, the next question is, what are the symptoms of sleep disc?
The most common symptom of a slip disc is a back pain or a neck pain, depending where the slip disc is. The most common signs for the slip disc, number one, is the lower back. Where? Right above the tailbone, right at the baseline. That is the most common sign. And that is referred to as the L4, L5, or the L5 spine. Those are the two most common signs. The second most common sign is the lower neck, where the neck meets the shoulders. That's the C5, C6. Or it could be at C4, C5, or C6, C7. Now, symptoms is going to be neck pain. A lot of time, most people will feel or believe that it feels like a muscle pain. It's described as muscle cramping, muscle pulling. They think it's like a simple ache. It feels like a muscle ache. And the reason why it feels like a muscle ache is that when a disc slips, it pinches nerves. And some of these nerves have pain sensitive fibers, which gives you pain immediately, especially when you move. But other nerves that are pinched also control your muscles, will make your muscles tight and feel cramp-like, tense and uncomfortable. So, common symptoms, cramp-like pain sensations in the neck and back. But as the slip disc advances, as the pressure increases on the nerve, as it protrudes or slips more and more, then the greater volume of nerve is compressed. And with that compression, you get more damage. And then you notice that it's not just hurting your neck. It may be also, coming from your neck, it may be also hurting between your shoulder blades, top of the shoulders, down the arms. Could cause numbness and tingling in later stages, burning sensation in some more later stages, and in late stages will cause weakness to the point that it would be difficult for a person to lift a cup of coffee or water, or to squeeze. And the same can happen in the lower back. I'm sure you all have heard sciatica or sciatica, depends on the pronunciation. Sciatica or sciatica, which is the same thing, is caused by slip disc. Sciatica is not a diagnosis, in my opinion, it's descriptive of symptoms, meaning pain that runs down the back of your legs. They termed that sciatica, but now we know that sciatica is from slip disc, where a nerve is compressed and it causes pain. And the pain can be disabling, could be excruciatingly severe. I've had grown men cry like babies. But it's not always painful. I've also had patients with slip disc that had zero pain. They just had numbness and weakness in their legs, and they couldn't figure out why. Or they felt very, very dizzy, and they had a lot of headaches, but no back pain, no neck pain. So the symptoms can vary and sometimes can be confusing. A lot of times even doctors make a mistake that it may be a heart attack or a heart problem. And I had a patient not too long ago, almost went through heart surgery until we took an MRI of his neck. So the symptoms could be very confusing, especially in the initial stages. Which is why I always tell people that if you have neck pain and back pain that keeps coming back, it's not muscle. The muscles in your neck, histologically speaking, if you put it under a microscope, is no difference than the muscle in your biceps and your arm. Your arm muscle doesn't go to spasm every week. Neither should your neck muscles. So if you have chronic neck pain that keeps revisiting you or keeps coming back like an old relative that you don't want to see anymore, something is wrong. So get it looked at. It can be a slip disc, or it could be a pinched nerve from something else. But the most common symptoms that comes is nerve related, and they can vary.
Oh, okay, thank you, Doctor. So Doctor just mentions that there is a symptoms that we can be aware, but there is symptoms that not show there's a weakness to our legs or our muscle, right? So I have read that if the case is severe, we need surgery, but many people tend to get a chiropractic care to take other alternative for treatment. So is there any like chiropractic technique that you use to treat slip disc?
Yes, in chiropractic there are hundreds of techniques. There is no bad technique. I always say that. Even when I went to IU give a talk to the students there, I told them that there's no bad chiropractic technique, there's just bad chiropractors. They're all good, okay. But in order for it to benefit, let's say, a patient with a slip disc, it has to be specific to their condition. Now, yes, a lot of people, when they have slip disc, they believe it's mild, they need surgery or injections. In my opinion, no. I have treated successfully patients even with severe slip disc, and they have recovered. And we've documented those successes with pre and post MRI. In other words, MRI before, and then a few months later we took another MRI. Even the orthopedic surgeons and spinal surgeons and all that, they see that they're shocked that, oh wow, it can be reversed. Yes, a slip disc can be reversed. But in order to reverse it, you have to do the proper treatments. Yes, there are alternatives in slip disc treatments. Chiropractors say that they fix it. You have these Kung Fu masters. They are also very, very busy on social media, and they want to Kung Fu a slip disc back into place. That's one. And you have a lot of other practitioners that say it. But to me, a slip disc is a type of back or neck problem that needs precision, a very precise treatment, and it cannot just be done with the hands. You have to use machines, advanced technologies to treat it. So it has to be a multi-pronged, multi-disciplinary approach, not just chiropractic, but also physiotherapy. Now, some chiropractors, or most chiropractors, would do, in chiropractic, the basic is when they, to put all the techniques into, let's say, two forms. There's the rotatory technique, the ones that you may have seen on YouTube, the ones that cracks the neck and back. And there are the non-rotatory technique, which you may not have seen on YouTube because they're not as fun to watch. because there's no cracking, there's no twisting, and there's no shock and awe. Okay, so they don't put those on you. But a slip disc patient should not have their neck cracked or twisted. It does not matter who that person is treating them, whether a chiropractor or a physiotherapist or anyone else. So in my opinion, slip disc needs a very, very non-aggressive chiropractic manipulation or treatment that is given without twisting or cracking the back.
Oh, so we need a precise technique to cure the CT. So there's no cracking in the neck or like the sound.
It's because see what happens. I don't have my slides, otherwise I could have gone through the slides and we will put them up so I can explain a bit more. Because we need to see pictures and I don't have those pictures. I'm just talking from talking points. A disc is made out of two parts. The very center of the disc. Can we get the slide? I think it will be better if we go to the slides so I can explain everything. Then we can sit down and count. I'm going to stand up if that's all right with you guys. So that way I can go back in here. Can I move this sign a little bit?
Yes.
So I can see everyone? I'm sorry. I'm shifting everything here for everybody. Okay. Are you controlling the slides? Okay, we can skip this one. Okay, we talked about the spinal anatomy earlier, and I passed the spine around. I'm sure you guys are all looking at it. We talked about the neck, the mid-back, the lower back. The neck has 7 bones, 6 discs. The mid-back and upper back thoracic spine has 12 bones. The thoracic spine has 12 vertebrae. Vertebrae are spinal segments. The spinal bones are called vertebrae. These little guys. What's in between them is the disc. The lower back has 5 discs. The thoracic spine has 12 bones, 12 discs. The neck or the cervical spine has 7 bones, 6 discs. Next slide, please. Or I can come in here. Which one is the front and back? How do I do? The shift. Okay, perfect. Okay, the 9 key functions of the spine, I'm sorry. Okay. The spine basically is, the most important function is that it connects my brain to the rest of my body. That is the amazing part of the spine. It has many, many functions. The brain system signs the skull and it traverses or it goes through the opening at the base of the skull on to the canal of the spine and down to our extremities, our organs. It controls everything. So the most important function is the connection that we have between our body and our brain. In addition to that, it supports you, supports your weight, it allows you movements. It gives the nerves, the spinal cords protection from harm. It allows for a point of attachment where your pelvises can connect to or your rib cage can come to. It anchors the upper extremities and allows for attachment of the lower extremities. The spine is a very complex structure. It is meant to last over 100 years. But unfortunately, our daily lives and our activities does not allow us. Now, we talked about the spinal disc. To me, the spinal disc is the unsung hero. We made a little image there. The spine is the Superman, and the disc is the actually unsung hero, because it is the connective part. The disc, the most important part is the disc in the spine, aside from, of course, the spinal cord and spinal nervous system. Why the disc? Because it provides a connection. It's not just a cushion. It is also a connecting point between the various vertebrae. Now, we have a little video there. We talked about a slip disc and what is a slip disc. You can watch that little video that will keep replaying. The disc itself, as I said, is the unsung hero of the spine. It has 2 main parts. The center part, which is the nucleus pulposus, this is the main part of the disc. This is the heart. This is the main part. That's the disc itself. The outer ones that you see getting pushed, those are referred to as the annular ligaments. Okay. The annular ligaments attach to the bones above and below, and its function is to hold the disc in the center. The nucleus, I mean, not the disc, the nucleus of the disc in the center. The nucleus itself is gel-like, much like the jelly inside the donut. So the annulus is more like the door on the jelly donut. So when the disc is damaged, just like when you squeeze a jelly donut, the jelly pops out. Similar thing happens in a herniated or a ruptured disc. But in here, you get more than just a stain on your shirt. You get to compress your spinal cord, which can in turn disrupt the function throughout your body. Now, in order for our bodies and our nervous system to function well, we need a healthy disc. Why? Because having a healthy disc means you have a healthy spinal cord and a healthy nervous system. There are many, many other players as far as your nervous system is concerned, but our topic in discussion is slip disc. So I'm only going to cover slip disc, otherwise this is going to turn into a day event. Okay? And I don't think you want me to talk for a day. Now, when we look at a disc, as I mentioned, the nucleus pulposus, the annular fibers, these protection connects the vertebra. Right, this is the front of your body and this is the back of your body. The spinal cord is a tube, and I forgot to bring the tube. The spinal side of the spinal cord is say in the neck, as it traverses down to your mid-back and lower back. It's about 17 millimeters. That is about the size of my finger. You have a tubing that goes down from the base of the skull all the way down to your tailbone. And inside the tubing are the fibers that come from your brain all the way down, coming out at different parts of the body to control organs. Not just muscles and ligaments. These nerves that come from the spine, you have to realize, they're not just there to make my arm go or my leg move. They also control my heart, my lungs, my liver, my kidneys, my reproductive organs, my immunity. Everything is protected by them. And in return, also, they protect the brain because it helps allow the flow of nutrients to the brain. Now, the problems occur with the disc, or symptoms occur when these fibers start to invade the room that is reserved for the spinal cord. This being spinal cord, and at each segment, right where the disc is, you have one nerve that comes out on the right and one on the left. These are spinal nerves. So if a slip disc is in the center, it will impact the spinal cord, which is nasty. But if it's on the sides, it can impact the exiting nerve roots. This is why a lot of times people have pain in their hands or in their fingers or in their lower back. I'll try to go quick through these so that way we can sit down and answer a lot of the questions and then give you a demo. Sciatica, most common cause, a slip disc. It can cause pain down the leg, and a similar type of thing can happen also in the neck. When you have a slip disc in the neck, they don't have a term like sciatica for the upper part, called radiculopathy, but that is a very loose term, means pain, shooting pain down the arm or down the leg. Sciatica is a pinched nerve from here that runs down here, and the pinched nerve in here is often due to a slip disc. Similar thing can happen down the arm. Now, this may be a bit more complicated image, and I hope you can see it well from where you are. On the left, over here, or I should say on the right, depending on which way I'm facing. On the left is a healthy disc, and on this side is an unhealthy disc. We're not talking about a slip disc, we're talking about the stage before the disc slips. Earlier, he asked me what are the causes. The most common cause is a degenerated disc. A disc has to get damaged first before it slips. It cannot slip. It proved it already, and this is why after that research that I discussed, they said in order for a disc to herniate, there must be some wear and tear, because a healthy disc, it is impossible for it to slip, no matter how much weight we put on it. The bone broke before the disc did. So, a healthy disc, the main reason why the disc is so strong is not just because of the nucleus, but also because of these fibers. They're crisscrossed. at 120-degree angle, interwoven, very, very tough structures. And there's punching. You push them down, you take the pressure off, bounces back. They're like a spring. But a spring that the body keeps improving, a spring that the body keeps replenishing, so it stays as strong as it has ever done. But that spring gets damaged. Why? We sit. We never have sat in our lives as human beings as we have in the last 10 years. Everything we do is sit, 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 sit. You're at home, what do? You sit. You go to work. On your way to work, what do? You sit in the car. And then finally you get to work. What do? You sit. And reverse going home. And yippee, it's the weekend. What's the favorite pastime in Malaysia? Dinner and a movie. Or go makan. What do? You're not going to eat standing, that's not sunnah. Must sit. We sit all day, every day. My parents' days, they didn't sit this much. Today, you can have a meeting with thousands of people, and you can have that meeting while you're sitting in your bathroom on the toilet, and nobody would know. Okay? Everybody sits. In the old days, there was no phones, there was no Skypes. People walked, they were active. And slip discs, yes, did occur back then, but back then, 30, 40 years ago, slip disc was a condition that was most often seen in the laborers. These are the people that do physical work, a lot of digging, a lot of this, and they get injured, bending and twisting. Well, the same is happening now, but those guys are in better shape than the executives. Now slip disc is more common, and the office worker, actually, a lot more common. Nearly every office worker has a disc problem. But what is worse now? Something that did not happen 15 years ago. You know what it is? What's causing this slip disc in your generation? All day long. The need to stay connected. Ever since Facebook came about, people are having more neck problems, more back problems. You want to stay connected. You sit and do this all day long. My youngest slip disc patient was a 10-year-old girl. Horrible slip disc. 10 years old, not even a teenager. And my oldest is in their 90s. And I have every age, and it's fast impacting your generation, so you have to be very careful. Because when I was your age, we didn't have cell phones. We didn't stay like this. My uni day, the professor gave me a project. I had to walk to the library. Many times I had to go 5 or 10 different libraries to find it. And when I finally get to the library, yes, they have the book, and I go there, it's checked out. Then I go to another. Today, you guys, on the internet, you can find everything. You don't have to leave. So you don't get any physical movement. You have to make time. Now, why do I say that? It's because sitting, as we sit, as the load comes down on top of our spine, the pressure inside here builds in a healthy disc. Let's say you all have a healthy disc, and inshallah you do. Say, Ameen, Ameen. Now, let's say you sit all day long and the pressure inside this disc increases. When the pressure increases, it starts breaking down the tissues. And the nutrients that are supposed to come into a disc does not come in. Every single tissue, every single cell in your body needs nutrients. It needs water, it needs oxygen, and it needs amino acids. And it may need sugars too. And it does. It doesn't mean that you can go load up on sugars, but our cells need it to regenerate and repair. And the disc is no different. But the disc does not have, like your muscle, a direct blood supply. It must obtain all the nutrients it needs from the bone above and from the bone below through the process of imbibition, sucking basically. Which is why if you measure yourself in the morning, you're taller. And if you measure yourself in the evening, you're shorter because of the disc. and that's the process of inhibition. So they did a study and they found out that human beings on the average 1.8 centimeters could be taller because of the disc degeneration, or are much taller in the mornings. And they also did a research on the astronauts that returned back from the space station, and they found that most of them were at least 2 inches taller when they landed. It didn't last long, but it was taller. They were taller. 2 inches. That's quite a bit. That's 5 centimeters taller when they came back. And they found out that all of that height gain was in the spinal disc. So gravity is not nice to us. It's not good to us. Gravity pulls us down, but when you sit, that pressure increases tremendously more. With that increase in pressure, dehydration into the disc stops, but the hydration that's present also gets squeezed out. And when it gets squeezed out, it narrows, and it also damages the end plate. And that is when you get a damaged disc. And the main reason why this happens is because of the stresses that we place on it. Spinal disc damage, as I just mentioned, the main cause is the interruption of the process through which it obtains its nutrients. The nutrients a disc obtains is, as I said, from the bone above and bone below through the end plate. End plate must be smooth. End plate is a 1 millimeter thin. It's a thin little fibrocartilaginous structure that connects, there's an interconnecting part. The disc directly doesn't go into the bone. It has to have a middleman. Okay, it has to have a middle structure, and that middleman is the end plate, and that end plate is 1 millimeter thick. But that thickness of the end plate also helps it get the blood from the bone and transfer it into the disc. But what happens is when you have too much weight coming down, the end plate starts to deform. So it does not soak up as much of the nutrients it needs before it can transfer it. It's like a stopping station. If the stopping station doesn't work, nothing else gets passed. Okay, it's a gatekeeper. So what happens is this vascularization, the nutrients don't go in, and you get the process of damage happening. In other words, the disc does not receive the nutrients it needs to rebuild itself. So if it doesn't replenish and is not able to replenish, it will weaken, just like you. Try not eating for 3 days and see what happens. Yes. The disc that's under stress cannot get water in it or the nutrients it needs. So this is why it degenerates. And when it degenerates, it weakens. When it weakens, it slips. And when it slips, it can be detrimental. I said earlier, he asked me, what is the number 1 cause? What's the more common cause? Axial loading. Axial loading is sitting or carrying very heavy boxes on your back. Especially in Malaysia, I see school kids with big bags carrying. Small little kid, he's carrying more on his back or her back than she weighs. That's amazing. Yeah, the books are getting bigger and they have to carry so much. And of course, this is one of the reasons why they say 20% of kids 9 to 11 have early signs of degenerated discs. So axial loading, you have to be most careful when you sit. And I will go over in the demonstration part what is proper sitting, which posture you need to maintain, or which posture you should tell your parents, especially your parents and grandparents, especially if they're in pain. They want to know that, and you need to let them know that. We talked about the different types of slip disc. I don't have all 7 in here pictured, but we have pictures of some of them. The bulging disc on the very, very top, it just means the disc fibers are swollen. They may or may not at that point pinch nerves, but they are irritated. They're not healthy. Okay. They could be painful. And after that, it goes into the next stage, which is protruded. So in reality, a slip disc, again, loose term, 2 types of disc problem. You have a contained disc problem, and you have a non-contained disc problem. Contained and non-contained tells you how serious the disc is. In other words, let's say you have a contained slip disc and you have a non-contained slip disc. We divide them into 2 main categories. The word contained and non-contained is a reference to the nucleus, which is at the center of the disc, the healthy part of the disc, the main part, the jelly of the donut. Okay. We're not talking about the dough around, we're talking about the jelly itself. Now, when we talk about contained and non-contained, we're referring to the disc itself, the nucleus pulposus. A contained slip disc is like a protruded disc. It can be, a bulging disc is a contained one. And if you can see in this thing, you don't see the blue part, which is the nucleus, shifting in position, right? You can see it expanding a little bit, but it's not shifting. But in the next image, you see that thing, they're bumping a little bit. That is a non-contained. It's no longer bound to the area where it's supposed to be. It's coming out slightly. It's tipping a little bit. So that is a contained slip disc. This protruded disc is either contained or non-contained, but it becomes more dangerous because the nucleus, the main part of it, the jelly starts to slip out and it goes through different stages. And the worst, of course, is a fragmented disc. But even there's another stage after that. It's called a sequestered disc, and that is a surgical emergency. That is the one that I cannot help you with. That is end-stage slip disc because a part of the disc breaks off from the disc and it becomes a free-floater. It can travel up and down the spinal cord, cause havoc everywhere. So it must be surgically removed. Even a fragmented disc, I have treated all the way up to this and successfully reversed in some instances, or at the very least made them feel no pain when I got done. In fragmented disc, there's a partial fragmentation and a complete fragmentation. The one that the most that I can help with is early stage fragmentation, not end stage fragmentation. That's a stage before sequestration. So it is critical, if you know anyone with slip disc, to get treatments before that person ends in this stage, because it's reversible. And once it hits that stage, it must be surgically cut. And when a disc is cut, okay, in order for them to get to that disc, they have to remove bone, have to ligaments. It will never be the same again. A lot of times we say, okay, when I go to the surgery and I have surgery on my back or surgery on this, we expect to come out of there feeling perfect. Okay. That's not always the case. Okay. A lot of times also when we read researches about the different surgical procedures, they say it's successful 95% of the time, it's successful 99% of the time. But you have to look at the word success, both medically, clinically, and legally. Success, by definition, is any measure of improvement. In other words, if your pain is from 0 to 10, severe, a 10, and you go have surgery, it doesn't have to be neck pain, back pain, it can be any kind of pain. How you feel horrible, you're at a level 10 before surgery, whatever surgery. It could be a chest surgery, a heart surgery, a stomach, liver, whatever. And after surgery, your level 10 problem now comes down to, let's say, 9.6. Would you say that's successful? How many would say that's successful? Lift your hand if you believe it. What? It was successful. It's sad to say, but yes. Because the procedure made it better. So the definition of success, don't be fooled by it. Success is a measure of improvement, not a measure, any measure. If it was a 10, after surgery became 9.9999, it was successful. But from a patient's point of view, you say, no, that's not successful. Successful to a patient means zero pain. Successful to a doctor or healthcare worker means any improvement to success. Any measure of improvement. So you have to always remember that don't wait until surgery becomes an option, even though you read that's 95% successful. It depends on the terms and how that term was used. Now, slip discs in the old days, they used x-rays, or before even x-rays, which incidentally was invented the same year chiropractic came about, 1895. X-ray was invented in the same year. X-ray and chiropractic share a birth year. So before 1895, it was a guesswork. What to do? And during that time, and even after 1895, it was guesswork and x-rays. But the problem was that x-rays does not see the disc. X-ray only sees bones, or calcified structures, or foreign bodies, stones, whatever, but not soft structures like a disc or a muscle. It doesn't see. Okay. So before the MRI, which is the best test for the disc, examinations were done to identify patients at risk. There's a ton of orthopedic tests. These are called orthopedic tests. How many of you heard of that? Orthopedic tests? Orthopedic tests are basically a test a doctor, a physiotherapist, a chiropractor, or whoever you go to will do to see how your body reacts. It's the main purpose. I don't know why they call it orthopedic test. Basically, it means testing your spine, your muscles and joints, and put it in different challenging positions to see how you react to that. Its sole purpose is to irritate you in that position, and that irritation should be mild. In other words, if you were healthy, you would not have any pain. If you have pain due to a specific procedure, that means it was positive, meaning that something is wrong. Now, there's an orthopedic test for every single muscle or joint problem, including slip disc. And in slip discs, for slip disc, there are probably over 50 orthopedic tests. But I don't use all of them. Because as I said, the purpose of orthopedic tests is to irritate an area and then watch the response. And if you irritate someone's back 50 times to see what's going on with them, they're not going to be happy with you. So I don't use a lot of testing. I use the minimum and what I believe to be the most effective if I suspect someone of a slip disc. Now, here are some of the tests I put on here. Milgram's test, incidentally, is this one, where I would have a patient just lift up their legs, just 6 inches off the table while they're laying on their back, just lift both legs up, much like it's got this fella here, and hold it there for 30 seconds. You shouldn't have any pain, any discomfort, any stiffness. Some people can't even hold, some people can't even lift it up. That means, yes, it's with this. And of course, the sooner the pain or discomfort comes, the more serious it might be. The second one is, this is the old test. This is the last 20 years it's become famous because it's more specific. This is the oldest test, dating back to before 1800s. The SLR, straight leg reps. Basically, you have the patient lay down on their back and you lift their legs and tell me when it hurts. If it hurts in here, very bad disc problem. It hurts in here, not so bad a disc problem. If it hurts in here, it could be a muscle problem. And that's called an SLR. I haven't shown it in here. The other one is a cross-leg SLR. So let's say a person has a sciatica going down the right leg. You lift up the right leg just 5 to 3 inches. They go ouch, ouch, ouch. And then you lift up the left leg and they ouch, ouch, ouch in their back. That's indication for a slip disc in the lower back. And Hoover's test is an awesome one. It's a variation of the SLR. Basically, you have the patient, a patient that, let's say I have a patient, I have them do this. They can't do it, they can't lift up. They're too weak and too painful. Sometimes they're just weak, like I said. Slip disc symptoms we discussed earlier. It could be pain, it could be this, or it could be no pain at all, just weakness. Don't even know you have it. Just like COVID. Heard many cases. Grandma caught COVID, passed it to grandson. Grandma was feeling fine, didn't need medication, didn't even have symptoms. Grandson was in a hospital on ICU bed. No difference in slip disc. It doesn't have to cause pain, but often it does. Let's say that this person was not able to lift up because of weakness. No pain, just weakness. More than likely, it's slip disc. But still, I want to see how serious it is. So what I'll have them do, I'll have them put their legs back down and have them lift one leg at a time to see if that also causes pain. That's a good test. The other is that what we do is we use a reflex hammer. How many of you are familiar with that, a reflex hammer? To tap different areas for the, let's say, a slip disc, just to see how it impacts nerves. Okay, when you have a slip disc, nerves are compressed. With prolonged compression, nerve gets damaged. As nerve gets damaged, tone is lost, function is lost. So reflexes basically judges to see, it's an old fashioned. This is back in the day where there was no MRIs. So they came up with these tests, and reflexes are still being used. I still use it. It's a great tool. It tells me how bad or how much nerve damage there is. And those are the ankle reflexes or the the knee reflexes or the biceps and triceps and radialis reflexes for the neck. Another good test that I don't have on here is called the Valsalva maneuver. How many of you have had very bad backs in here? Does anyone in here have slip disc first? No one. How many of you have pain in your neck or back when you coughed or sneezed? None. You're all a healthy bunch of people. Alhamdulillah. A very good test for slip disc is called a Valsalva. But it's not just for slip disc. You can also detect abdominal issues or space-occupying lesions, tumors, and all that. It's basically a scenario where I have a patient take a deep breath in, hold it, and bear down. Much like you're sitting on the toilet and you want to have a bowel movement, you go. And, that's a test. If it causes pain, oh, it hurts. Now, a lot of times people do that, and I don't ask them to do that. I ask the same question I just asked all of you. Have you had pain when you coughed or sneezed? And you all said, no, which is wonderful. But one of the common things that happen to patients that have slip discs, especially if they have an acute flare-up, and you may even see some of your relatives when they cough or sneeze, they hold their back really quickly. Or they hold it. That's because it produces back pain. And that's a part of finding. That's another test that's not listed on there. But ultimately, as I said, MRI. MRI is the gold standard in diagnosing slip disc. And in here, I have 3 different things, from the oldest to the newest. And of course, the newest is the MRI. In 1895, X-ray was developed. Same word here as chiropractic. It's wonderful, but it does not see the disc. It sees bone, 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 space, air, nothing in there. And then in the 50s and 60s, they came up with CT. CT scan, a lot more in-depth, better, multidimensional. X-ray is not multidimensional, CT is multidimensional. It's tremendous, it's wonderful, I still use it, but very rarely. But most with an X-rays. Again, the issue was that it can see bone, it can see a lot of structures, but it does not see the disc. It's invisible. The disc is the invisible man. Until the 1980s. In 1982, the very first MRI was made. The very first scan was exposed using an MRI, and it was an image of the heart. And ever since, MRI is replacing everything. X-rays have radiation. It's cheap, doesn't hurt your wallet so much, but it hurts your body. CT has maybe 10 times more radiation than the X-ray. It's probably 3 to 4 times more expensive, so it hurts your body, your wallet a little bit, but it hurts your body a lot more. Fortunately, MRI only hurts your wallet. It's very expensive. It does not hurt your body. And the reason why is my number one to go-to tool for diagnosing, and for everyone it should be, any kind of spinal issues or chronic neck or back pain. The earlier, as I said, you discover this, the better. The reason why I prefer this is because it uses magnetic energy. It has no side effects, no known side effects. It's safe for everyone, all ages, 0 radiation. But those are wonderful things. Okay, that alone should qualify it as a good testing platform. But what makes it ideal is because we can actually now see the disc. It's no longer invisible. We don't have to cut through the skin and go layer by layer and say, hey, where is the disc? Is this, oh yes, let me close it back up. I'm taking an MRI image. And multi-dimensional, but better views, better imaging. It not only shows the disc, it shows the ligaments, it shows the spinal cord, it shows even the fluid of the spinal cord. It will even show us if there's any damage inside your spinal cord. It is literally as good as opening the back without opening it. And the best part is that it doesn't hurt your body, only your wallet. Now, we've talked about the discs, the non-contained and the contained. The contained was just, the nucleus pulposus is not moving out. See, these are all non-contained slip discs. A slip disc can happen at any segment, at any vertebra, at any disc. But we said earlier, when you and I were talking, most common here, second most common site here. And when they do slip, I'm only showing the slippage on this part. This is the back of your body, the skin is over here, this is the front part of the body. The discs that slip, they can slip forward, but rarely. And if it does slip forward, so what, who cares? There's no nerves in the front, no spinal cord in the front. But it almost never does. And the reason why it never does is because the ligaments between the bone above and below and the periphery, outside and front of our bodies, front meaning this way, are very strong, very thick, and it does not allow the disc to slip so much. So slippage is almost always this way, where we don't want it to slip. That's one of the reasons is because the ligaments in the back are not so thick. And they cannot be so thick, because if those ligaments in the back were as thick as the ligaments in the front of the disc, we would have less room for the nerves in the spinal cord. So, and that ligament that connects one bone to another bone and also the disc is called the posterior longitudinal ligament, the PLL. And the one in the front is called the anterior longitudinal ligament, the ALL, or the all ligament. That basically goes around. If it's in the front, it's called the ALL. If it's in the back, it's called the PLL. And the back is over here. But because it's not as thick, the ligament in the back, it creates a weakness there. So when there's a damage to the disc, it can't go that way. It must come this way. And it will always go to the weakest point, depending on what that is, or the point towards which it was stressed the most. It could come, it could slip at the first zone, the CCC zone, this zone in here, the central. That's called the central. And if it looks like this, it would be a focal central disc herniation. And that's a dangerous one, because that is going to compact or impact the spinal cord. Next zone after that is the subarticular zone. That sounds fancy. Articular means joint, sub means under. So it's the zone under the joint. Joints are over here. So the zone, the area right behind the joint. That's another area that it can herniate or slip to. And these are the further lateral ones. The most symptomatic or dangerous ones, the number one is this. This could paralyze. Nasty one would be this. This would be more of a sciatica, impacting one side, one leg. If it impacts sciatica, you have it on both sides, then more than likely you have a central that is wide-based. Okay. And the beautiful thing about an MRI is not only can we see discs that we couldn't see on the CT or X-ray, we can see the zone in which it is protruding or slipping towards, and the amount of pressure it's putting on it. Why is that important? Now, in the old days, we wouldn't know. Is the slip disc here, here, or here, or here? We have to guess based on symptoms. And sometimes, like I said, you can have a slip disc and no pain. Then it's even harder. You can't tell. The MRI allows me to know exactly where it is. Why is that important? Well, precision in therapy. Chiropractic is good, but precise chiropractic is better. General chiropractic, typical back pain, very good. But if you have slip disc, you need precision. You need to identify and need to know as much as possible about that disc. So that way, when we formulate a treatment plan, using not just chiropractic, but also physiotherapy. So I mentioned chiropractic also study physio. When you have that MRI image, it helps me identify where the weakest part in your disc is. Not just that you have a slip disc, but you have a slip disc, this is where it's coming, and this is how it's impacting you. And those are critical. in treating and identifying patients with slip disc. Now, I talked about slip disc is basically your spinal disc is the unsung hero because we take it so much for granted. We take it. I was you guys' age once. I never thought it would happen to me, but in reality, to be honest, I had my very first attack of back problems when I was probably the same age as most of you or younger than most of you. I was 24 when I was diagnosed with a severe slip disc. Out of the blue. Lifting, stupid posture, heavy boxes that were heavier than me. I was a very skinny boy back then, not the fat man you see now. So I was lifting boxes that were heavier than me, bending, twisting, carrying, and my back went pop and I hit the floor and I stayed there. And it was so painful I couldn't sit. It was so painful that I couldn't walk or stand. I couldn't even go to the bathroom. So they took me to the hospital there. They told me I need surgery, and that's the only way I can get over it. The neurosurgeon, and granted, you got to remember, I was 24. I thought my life was over. I was getting ready to go to medical school. I said, I see my life before me gone. And the neurosurgeon was very honest. He said, the chances of you being paralyzed without surgery is nearly 100%. The chances of you being paralyzed after surgery is 50%. Those are the odds you don't want to hear when you're 24. You don't want to hear that when you're 84. Let alone 24. I literally saw, I was depressed. I knew my brother was in chiropractic school back then. He was just starting out before me. I didn't want to be a chiropractor. I wanted to go to medicine. But I didn't think that could help that. But he said, that my surgeon said that the only way to fix this is surgery. Nothing else can fix it. And I believed it. And not that he was lying to me, but he believed it too. The nurse came and saw me, how depressed I was. She told me to go see a chiropractor, but don't tell anyone that I told her that she told me that. Then I went and saw a chiropractor. My brothers, 100 disarm, 100 disarm, they carried me in his office, dropped me on his table. 10 minutes later, I walked out on my own feet. And as soon as I got better, I changed direction in my life, and I went and studied chiropractic. I didn't go to medical school. And ever since my first day at university studying chiropractic, I was interested in the disc. Because, heal yourself first. And that was my passion. And that is my passion. Okay. And that is how I got into it. And the disc, I have come to realize, is literally the unsung hero. Why? Because when it goes bad, everything goes bad. Now, here is an MRI of a person with a very, very large disc problem in their neck. I am going to steal your pen. Okay, I don't want to point with my fat fingers. Okay, this is a side view of the neck. This point, okay, let me back up. This here is the spinal cord. These are bones in your neck. In between the bones is the disc. The most important part is this, spinal cord. Spinal cord starts here, right where my pen is. Everything above is brain, everything below spinal cord. So at a very fine and micromillimeter area is a transition between the spinal cord and brain. And that's the transition that we put on it. But literally they're the exact same tissue. In other words, your spinal cord is not a different structure. It's the continuation of your brain. That is why the spinal cord is important. And why is the disc important? These are healthy discs. You see the spinal cord's got the white area in the front, the white area in the back, nothing is pushing on it. It has that, it has to be fluffy, it has to be very soft, nothing can touch it, let alone push it. Now here's a very, very large, gigantic slip disc. Look at what happens to the spinal cord. And I chose this to show a bit more that a slip disc damages your spinal cord. And what is the spinal cord? I've said that a few times. Anybody remember? Or you're all falling asleep? Didn't sleep enough. I didn't either. But that's a different day. Spinal cord is continuation of your brain and it controls every single cellular activity in your body. It is a system, a communication pathway between what sits in here and in my fingers, what sits in there, and my beating heart. When that pathway is disconnected, disrupted, damaged, or pinched, or not working, whatever the area that impacts, those areas in my body will not work. At first, if the damage is mild, it will be my hands, my fingers, if it's coming from my neck. It can later involve my heart. Earlier I said that I had a patient, this is just within the last couple of weeks. He thought he was having a heart attack. And he went to his cardiologist. The cardiologist did the scan and said, yes, you are having a heart issue, sir. I'm going to schedule you, you have to go and do an op on your heart. And he was scheduled to go on Wednesday, a few weeks ago. He came and saw me on Tuesday. Do I really need to have a heart surgery? My cardiologist and cardiothoracic surgeon said, I need a little heart operation. I said, well, what's going on? He said, I have numbness in my tip of my finger. It goes all the way up my left arm. My chest hurts, my neck hurts, my upper back hurts, my shoulder blade hurts. All everything hurts. And my heart is not working good. It's fluttering. My heart. So I said, let me check. I did a few tests. I realized that, yeah, he may have a heart problem, but he also has a pinched nerve in his neck. I sent him for an MRI. He had a horrible condition, worse than this guy. That was even impacting his heart to the point that where his cardiologist thought it was a heart issue because it caused problems in the heart. Now, unfortunately, his condition was far too gone for me to be able to help, so I had to send him to a neurosurgeon. And he was so thankful. He said that you saved my life. You would have done heart surgery, and the problem was out of my heart. It wasn't my neck. So yes, while a lot of people believe that neck pain can hurt a lot, at first like it's going to kill you, but sometimes it can kill you also because of cord damage. Now, normal cord, as shown up here, this part of his body is gray. You see that? A damaged cord, you see this white area here? That cord is damaged. And I said earlier, same tissue as continuation of your brain. So he has a major health problem. It's not just a neck pain that he has to worry about. He has to worry about organ problems. So a slip disc is not just back pain and neck pain. It can cause heart problems, liver problems, digestive problems, lung issues. Why? Because the nerves that come at various parts of your spine control those organs. And a slip disc can pinch the nerves that go to them. And that is why it is dangerous to have a slip disc. So, non-surgical treatments we talked about. You can do chiropractic, physiotherapy, some do injections. Like his wife had injections, pain medication. These are all options, non-surgical options. To a certain degree, yes, they work. But in order to have lasting relief to a point that where these damages are repaired so it doesn't keep coming back over and over and over, you have to identify first the root cause and then do treatments. There is no injection or medication that can treat a slip disc. The injections they give and the medication they give you does not fix the damage in the disc, but it decreases your body's triggering effect of pain. In other words, it desensitizes the nerve as an anti-inflammatory or as a painkiller. So yes, you can have painkillers, but to me, painkillers are good only when you can fix a problem. Pain management is awesome. It can be done with injections and medication. In my opinion, it should only be done when there is no choice or no options for corrective care. Often, and unfortunately, in many, not just here, but all over the world, patients are put through pain management programs instead of corrective programs. I don't understand it why. You should only manage conditions that you cannot fix. You should try to fix them first and not manage them. And to me, two things that will enable that: chiropractic and physiotherapy. And if I'm a chiropractor, but I will tell you firsthand, I've been a chiropractor for almost 30 years now. Chiropractic alone is not enough. And any chiropractor say that with a chiropractic can treat a slip disc is nothing honest. You need chiropractic with physiotherapy, rehabilitation, lifestyle modifications, exercise, diet. You need to make changes in your life. You have to increase the good, decrease the bad. The decreasing bad is on your part, increasing good is what me and my physios and chiros can do for you. The main issue in the non-surgical treatment, the main goal, or my main goal, and this is how I fixed my back, I never went for surgery. And alhamdulillah, I'm glad I didn't, because I have zero pain, I have no sciatica. I was my own guinea pig. I did a lot of things, and in that process I found out what worked. Which was sort of sad, because I had personal motivation yet, because I had experienced severe pain. And to be honest with you, the first few years of my practice, there were days that I didn't feel good, because I had more pain than nearly all the patients I treated on those days. So I felt like a hypocrite. Here I'm telling patients that I can help them and I can't help myself. Okay, and that was my driving force. And alhamdulillah, I was blessed with the knowledge and the ability to do it, and I discovered a lot of things and a lot of reading every day. I read, and to this day now, I spend time reading. And one advice I can give you guys: read every day. You spend so much time on social media. Pick something that interests you. You're in the science, biomed, engineering. Pick a topic in those things. Read it. Read the abstract.
Sorry to interrupt. I have been told that our time we have don't have much time left.
Okay,
so,
I'm sorry. I keep going forever. Thank you for stopping me.
Okay, we continue to the Q&A sessions. Okay. So we are now open the floor to questions. So if you have a questions, you can raise your hand and or type it in the chat box. So we encourage all of the audience to participate, and don't hesitate to ask anything regarding what Dr. Yama have been sharing with us today.
You don't have to just focus on slip disc. You can ask me any question. Joint pain, shoulder pain, muscle problems, slip disc, nerve, whatever you want.
Assalamualaikum and good morning, doctor. My name is Nurdina binti Sharifuddin. My question is about physiotherapy. Besides doing physiotherapy at hospital, is there any kind of physiotherapy that we can do personally at home? Thank you.
When it comes, very good question, and thank you for asking. A lot of times people that have slip disc, they want to know, can they do anything at home? Yes, you can do quite a few things. You can do some stretching, some exercises, but you have to be careful. But first, the most important is to get an accurate diagnosis and find out how bad your slip disc is. Because some of the exercises that you do can hurt it. Okay, there are patients that can do certain exercises with a slip disc and they're fine, and the same set of slip disc exercise for someone else can make them worse. So don't go into YouTube and see what is the best exercise for slip disc. Most of the time the information they present there is wrong, and they just do for ranking. The single most important thing that I would recommend for patients that have an acute back pain or back pain that's resulting from slip disc is ice pack. Using an ice pack, wrapping it in a cloth, putting it on your back, but making sure not to put it on more than 15 minutes, and making sure to never put the ice pack on directly on your skin. That's a physiotherapy procedure. Very simple, everyone can do it. We all have ice packs. If you don't have it, you can get the reusable one. Aside from that, simple stretching is fine. Okay? You can do the dead bug exercises where you lay on your back and you have your arms up and legs in the air. You kind of sort of move different directions. And we can do that in the demo section. Or the cat and camel exercise, which I will show. You can do some basic exercises and some stretching exercises. But aside from that, like a lot of times the people I see, they do this, do not do that, do not twist or bend your spine. Okay. Do not try to lean and stretch. A lot of times people think that's good for us, but that's actually going to make it worse. Okay. So the best advice, I sit, rest, don't sit in a poor posture. Okay. And do some exercises, some very gentle exercises. Okay.
Thank you, Doctor. Is there any other questions?
My name is Dr. Anis, and my question is, are the effects of sleep disk permanent, or can it be healed completely?
And an excellent question. Slip disc can heal completely. Well, completely to me is 100%. I'll take that back. Only Allah does 100%. No one else. It can, if it's a miracle from Him. But the treatments that we've done, yes, we have reversed many slip discs, and I can go back in here and quickly show some slides and show some after results that patients that we treated. Here's a patient that came in with a nasty slip disc. You can see bulging here. We did non-surgical treatments. It's never perfect, but it's better than what it was. So if you do the right treatment, yes, it can reverse, but 100% only Allah does.
Okay.
Did I answer your question, or did you have another one?
Okay, thank you, Doctor. So there is a patient that reverse the arthritis. Okay, thank you, Doctor. Is there any questions?
Okay, hi, Assalamualaikum. My name is Muhammad Faris. So my question is, student often suffer from head pain. Some may caused by our lifestyle or the way that we sit, and it can be severe that maybe develop to sclerosis. So my question is, will you say that sclerosis and sleep disk is correlated, and what is the relationship between the two, sclerosis and sleep disk? Thank you.
That was a beautiful question, and I forgot to mention that. There was a research done not so long ago that they studied the spines of patients with scoliosis. And when you read about scoliosis, and always you see unknown etiology, 80% is unknown etiology, meaning that they have no idea what causes, but it's there. Very few cases is known to why scoliosis happens. But when they did a research study studying spines of patients through MRI, patients, young people with scoliosis, they discovered that in nearly all cases, the discs were damaged and that they had bulged out of their proper position. There is slippage, usually almost always. Now, it may not have started in the disc. It could have started in the imbalances in our bodies. You know, the right side of your body is never the same size as the left side. You know, the right side of your face is never the same side, and those lucky ones that have a balanced facial structures where the eyes are similar size, the ears are the same exact eyebrows, they become supermodels. They become millionaires overnight, billionaires. Very few people, maybe 1 in 10 million, are balanced, but most of us, we have a dominant and a non-dominant, or a shorter and longer side. And if those discrepancies are significant, it can also impact the spine and can cause scoliosis. And there are some muscles, tiny little muscles, that can cause it too. But now they're saying there's a role of the disc that is also as critical, as important. But one thing for certain and for sure is that if, let's say, they have not come out and said that slip disc causes scoliosis, because scoliosis can happen at a 9-year-old. But they will say, and it has been proven, that if you have a nasty scoliosis, you will have slip disc. Various forms. So they are interconnected. And yes, when I treat, and I do treatments, and we do treatments for a lot of scoliosis, and a lot of our procedures that we follow for scoliosis similar to what we do for slip discs. Because in order to help a slip disc patient, we have to treat the joint, the disc, the muscles, the ligament, and the same is true for scoliosis. A little differently, but similar. So yes, there's a very, very strong link, and they're studying it more. And I do believe there's a link, and it could be a congenital issue, that the disc was not positioned. The nucleus pulposus, the gel like the jelly of the donut that we talked about. In some cases, they're saying it's not at the exact center of the vertebra, it's closer to the one side versus the other side, creating a wedge which in turn slowly can turn into scoliosis. That is being researched right now, but unfortunately, these researches are usually performed on cadavers, and not too many cadavers that are 8 or 9 year old that parents wish to give to science for study. So it's going to be a slow progression. I hope that answers. Do you have any other questions on scoliosis or slip disc? No.
Assalamualaikum, Doctor. I'm Dr. Susanna. I'm the advisor of this association. Okay. Thank you for coming today. I have a question on CTs. Okay. As you mentioned just now, sitting all the day during working might affect the CTs. And I have a friends who suffer from the CTs and gone through operation. So do you think with the non-surgical, I mean that post surgical process, and do you think that non-surgical treatment just now is suitable, or is it applicable for those who have gone through the operation? This is my first question. A second question is not regarding to the CTs. I'm also experienced a knee problem, knee joint, which it has been injected by 2 times, by gel 2 times. So is there any, is there chiropractic treatment is suitable before go to the other operation? Because I was advised for the total knee replacement.
You're too young.
It's already, yeah. I think because of maybe my obesity. Maybe you can suggest, or maybe you can give some suggestion or opinion. Thank you very much.
Inshallah. Very good questions. Both of them are excellent questions. Unfortunately, going to the knee first. A lot of people are being encouraged to have a knee replacement surgeries. You are way too young to have a knee replacement surgery. There are a lot that can be done, and spine surgery or knee surgery is not a curative. Okay. Many times I've had many patients that I've had 1, 2, 3, 4. I've even had one guy that had 4 surgeries on his lower back, and he still had pain. He went back to the same surgeon that had cut him open 4 times in the matter of 10 years. In 10 years, he had 4 surgeries. And every surgery, cutting more. 5th time he goes back, says, I can't. My back is hurting so much. I keep falling. My foot gets cracked. And I almost killed myself because he fell, he hit his head. Fortunately, he didn't hit the edge of the table, he hit the front of the table. He cracked his forehead, he broke it. But he didn't kill him. Had he hit the table 3 inches this way, it would have gone in and he would have been dead because of his slip disc, because he fell. He went back to the surgeon knowing that he would recommend surgery, but he was shocked when he went there. He went to the neurosurgeon. My back problem, my slip disc problem is bad. I can't, my leg cannot hold my body, my feet drags, I feel it slip, and nearly killed myself. And neurosurgeon, much to his surprise, said, no more surgeries for you. And he was like, why? He said, there's not much lift for me to cut anymore. You cannot have any more surgeries. And that is when he came to us. And this was one of my first patients I saw in Malaysia. To this day we're friends. And he's now playing golf. Okay, so yes, chiropractic is wonderful, but it has to be the right type of chiropractic. Okay, I'm not saying that all chiropractors can do it. There are great techniques in chiropractic. It's not just saying that, oh, if you follow this technique, you must be good. It's also knowing what technique, what intensity, what to do, what not to do. There's a lot that goes into it in formulating a treatment plan. In our centers, we have a very, very specific follow-through when it comes to surgery. And we have patients that have had surgeries that we've treated that they didn't want a second one, or a third one. Or in his case, he wanted the fifth one because he didn't know. His surgeon told him no the fifth time because he said that there's nothing that I can do. He will be paralyzed. That's when he came to us. So, well, the questions about your friend who has back pain and either thinking of having surgery or what type of treatment needs to be done. Yes, post-surgical rehab is very, very critical. But unfortunately, many, chiropractic and physio is great. I think these are the two best non-surgical fields. But there are differences between therapists and between chiropractors, and there's also difference between medical doctors and surgeons. Some surgeons kill almost everyone they operate on, others they do wonderful, just like the chef. You go to some restaurant, they poison you. You can't function for days. And other restaurants you go and they make you food that you remember 10 years later. So there's good and bad in the profession. And when it comes to slip disc, you have to be highly picky in choosing who you use. If you do surgery, you have to have rehab and physiotherapy and even chiropractic afterwards. But it has to be very specific form. Because if they do the wrong form of rehab and physiotherapy, you will end up having another surgery. Okay. Most patients that have surgery for a slip disc will go for a second one. And nearly everyone that goes for a second one will end up going for a third one. Some stop going because they try chiropractic and physiotherapy. That's why they don't have the second one. But almost everyone will have it. The earlier you have the surgery, the longer it's going to impact you. Look at today's world. When I first came to Malaysia, little back story, life expectancy in Malaysia was in the 60s. I was shocked. I was like, oh wow, people don't live here that long. That was one of my concerns. But alhamdulillah, over the years, life expectancy has tremendously improved in Malaysia. It's in the late 70s, almost the early 80s. Klang Valley 80s, but some come home, not so much. Because people are more aware of what they need to do, the diets and the foods that you should have. Exercise is important. So we're living longer. In US, they have cities, they call it the century cities. These are the cities where they have people that live over 100, easily, that most live over 100. So people are living over 100. Your generation specifically, my generation, people, I'm going to hit 60 if Allah allows next year. Now, my generation, people who are in their 60s are surprised if they die before their 80s. Honestly. Your generation will be shocked if you die before 100. So my advice to everyone here is plan to live to 100. If Allah allows you, alhamdulillah, you're there in style. If it doesn't, you're prepared. We all prepare for retirement, but very few people prepare to enjoy that retirement. My office is filled with people who have gigantic bank accounts, but they have wealth, but they don't have health. They spend hours every week in my office. Plan on health, that's your great wealth. So avoiding surgeries early in life is key, critical to that. Because if you're going to live to 100, and if you have to have surgeries, how many surgeries are you going to have? Is the surgery going to be a cure? No. No surgeon will tell you that this surgery will cure you forever. This is why they don't give you a guarantees. And they cannot. It's not that they're lying. They'll do their best. Surgery is a patch. So for your friend, it's best to engage into activities. very precise doses of this, even if they don't have pain. And if they are still having pain, they need someone like me, someone to assess them, give them proper non-surgical options. Now, the second part of the question was about your knees. Knee is a common problem. 1 in 5 people will experience knee problems, especially nowadays, especially in Malaysia. Why Malaysia? Because we walk too much, and the homes, some homes, the contractors don't follow the rules. Ideally, the steps are supposed to be about 6 to 8 inches apart. But sometimes there are places that I've gone to, every step that I stepped on was a different height. So, and if you live in a multi-level house, and if your steps are higher than 6 to 8 inches, you're stressing your knee quite a bit. And also, especially in Pine Valley, where, you know, homes go this way, where my home stayed in US, homes went this way. There are only 1-floor homes. But in here's multi-level homes, so people go up and down, because they keep building, because land is too expensive. And if building is cheaper, land is expensive. In US, land is expensive. Sorry, land is cheaper than building. Contractors, you pay more for construction than you do for land. In here, you pay more for land than you do for construction. Okay. So they rebuild this way. It's cheaper. Now, that comes at a price, especially if the steps are not done good. So what happens, going up and down the stairs, up and down, you put this on it so the YouTuber, people on YouTube can see this too. Excessive wear and tear. Usually, for the 1-year age, could be a meniscus issue, or it could be a problem in the patella. Patella is the kneecap, the little floating bone that you move around here. And that is connected to your quadriceps. Now, when we go up and down, when this quadricep is too tight, it forces this kneecap to get shoved against the thigh bone. And over, friction produces heat, and that causes tears and damage in your cartilage. And as end result, wear and tear. And then someday, someone, somewhere will tell you need knee replacement. If that surgeon especially needs to make some payments, he would recommend knee replacements for you. In Malaysia, they do knee replacements far earlier than they should. I have had a 40-year-old and a 30-some-year-old recommended knee replacement when in fact she did not need it. Knee replacements last 10 to 15 years. This is not like a shoe that you replace, that you can go back 10 to 15 years to buy a new shoe. No. 15 years, done. You cannot take it out, you cannot replace it again. It's done, it's a one-shot deal. It goes good, it goes bad, bad. Even if it goes good, it will go bad in 15 years, even if you're there. So that's the last option, and in my opinion, you should only keep on when you're in your late 60s or 70s at your age. So for someone your age, you can sit, you can stand, and I see you have your knees bent. You're not at knee replacement surgical state. So that surgeon, that ortho knee specialist, I don't want to know his name, but I would not go back there if I were you. Definitely there's options. I have treated many knees and a lot of people that can't sit like you. And they get better, you will get better. And I don't see you coming in here with a walker. The only ones that need a knee replacement are the aunties that can't walk, that can't sit like this because their knee hurts too much. And they can't stand. She has no walker, no cane. There is therapy, but it has to be very specific. Have they done an MRI for you? There's damage in there. Still hope, inshallah.
Thank you, Doctor, for answering the questions just now. I think that's all. Thank you, Doctor, for your sharing and answering the questions from the students and the audience of the YouTube live too. So that is the end of our forum for today. On behalf of the Applied Science Youth Care Group, we would like to thank Dr. Yama for very much for his talk. On behalf of Applied Science Care Group, we would like to thank Dr. Yama on the very valuable and insightful regarding this. But before we end today's program, we humbly ask the audience to stay with us today for the next slot. The next slot is the demonstrations that led by Dr. Yama and his team from the Chiropractic Specialty Center. The goods come from Allah and shortcomings are from myself. That concludes our foreign sessions today. Thank you. Assalamualaikum warahmatullahi wabarakatuh. The session is now handed back to our Master of Ceremony, Ms. Nur Asma.
Thank you to our panelists, Dr. Yama Zafri and Mr. Ahmad Kashful, for skillfully moderating this morning's forum session and sharing their insight. Before moving to the next segment, the program will take 5-minute break for the demonstration session. Agenda with a demonstration led by Esteemed Dr. Yama Zafri, Chiropractic Specialist, Founder and Director of the Chiropractic Specialty Center, along with his professional team brought specially from the center. With great respect, I warmly invite them to the stage.
Hello, I'm back. Am I going to have some volunteers? Yes, no, maybe? Who wants to be assessed? Who's got neck pain? Who's got back pain? Who's got shoulder pain? Who just wants a quick assessment? Probably a guy would be better. So come on, one of the guys back there, so the ladies don't let the ladies win. So I can demonstrate, but I need someone. There you go. Brave fella. So, any problems? Okay, how bad? Can we? Everybody will know what kind of problems you're having now. He's probably already regretting why he came up here.
Maybe around 1 to 10. 4 to 5.
4 to 5. And the lower back? In the center or one side? In the center. How long has it been going on for?
It's not frequent. Yes, sometimes maybe a lot of for long I'm not quite sure for how long.
Okay. When you're sitting down for a very long time and you get up, do you feel stiff?
Yeah, sometimes.
Or you kind of taking the first few steps like an old man? No? You get stand right up and...
Yeah.
Okay, alhamdulillah. Not so bad. Okay, what I'm going to do is I'm going to do a couple of tests. A few tests on you. Some of the same ones that I showed there. It shouldn't be painful at all. To see why you have... How old are you?
23.
Oh, very young. Very young. So you shouldn't have back pain. It's not normal to have back pain at any age, especially when you're 23. 4 years ago, you were a teenager. Okay. Let's get you to lay on your back for a second. Head over here, feet there. We're going to do a couple of quick things. The one that we talked about, the slip disc test, the same things that I had him do. I don't think he's got a slip disc, based on what I talked to him about, but could he have it? Yes. He's 23, yes. My youngest patient is 9, or 10 years old. Put your hands on your tummy, just like so. Bring the other one too. Nothing that I do is painful. I'm not going to crack your back, don't worry, relax. I'm just going to do some tests to see if we can find out what is causing it. First, to see if it's a disc. Okay? So what I'm going to have you do, I'm going to have you put both feet together, and then I'm going to ask you to lift them up. When you lift them up, you hold it up. If you have any tension, any stiffness, any discomfort, drop them down. Okay? Wait. Timer. I want to see how long you can test it. Yeah, you didn't think you were going to be working out today, did you? Okay. Reset. Ready? Put both feet together. Lift them both up. Go up. And hold it there. If it causes discomfort or pain, drop it down. Otherwise, keep it up. Any pain? A little bit. He had pain less than 8 seconds. And you know what else you saw? His core muscles are a bit weak. And that's a common thing in all you people's age. You guys don't get enough exercise. So by the time you get to be my age, you'll be walking like this. But that's the bad news. The good news is your generation has the strongest thumb in all human history. You know. Oh. What is she putting in my face? See something coming. Sorry, I forgot. So, you have to be very careful. Your generation has the strongest thumbs. Yes. You can wait until thumb push-ups become an Olympic event. Then you can compete there. But it's better to do the exercise. His core muscles are very weak. And he sits all day. That's a recipe for disaster. Every single 20-something has a weak core. That's the pelvic floor muscles. Those are the muscles that you walk with. Those are the muscles that you move around with. Those are the muscles you play sports with. But the only sports most of you get is online. Okay, and this is why your core is weak. So your spine is under greater stress. And when you sit, you load your disc. Then you are suspects for a slip disc. You do have a disc problem. Okay. And that's a common thing. 80% of people that have recurrent backaches. Like I said earlier, a lot of times people say, oh, I have the normal backache. There's no such thing as ache and normal. Those two words, pain and normal, are not to be put together. It's like saying I have the normal heart problem, or I have the normal heart attack. There's no normal neck stiffness, there's no normal back pain. If you find yourself having pain or discomfort frequently, something is wrong. two options. Get it fixed, looked at, fixed early, or wait until it gets you down, then you go to surgery or fix it when it's harder. You have a problem. Part of your problem is that you have weak cores. And the other problem is that you sit too much, maybe in the wrong posture. Maybe your mattress is also not good. And your footwear may not also be good. So the combination of all of these things have now caused the disc to degenerate and maybe even have slippage in it. I'm going to do one more test to see if that causes pain. I'll put this down and you hear a banging. I'll give it to her. Now, you have pain when you're lifting both. Lift up this leg as far as you can. Pain? This one? Alhamdulillah. Pain? Okay, alhamdulillah. Not so. I'm going to put this over here. I'm testing his hip. Pain? Alhamdulillah. This one? Nothing. Now, sit up, face your friends. Take your legs over. I'm going to turn to the right. Pain? Turn to the left. Pain? Now I'm going to have you lay down on your tummy, but you don't have a hip cover for this. Face down so you can put your head over here so you don't have to put your face down on your tummy. Just you can put your arms under your face. Put your hands under your No. There you go. Just relax. Not an ideal situation. He's got a little bit of tension here. Pain in there when I press?
No.
No. Good. Alhamdulillah. Any pain in here? Any pain in here? Nothing there. Pain when I press on the bum? Good. Pain when I press on the bum here? No. Good. I'm going to bend this leg. Any pain? That's what. Good. Pain. That's it. Coming up. Thank you very much. Okay. Actually, his spinal muscle mass is not bad. But he's done some things right. You play sports? No. But it's genetics thing. But your core muscles are weak. And the fact that when you lift up your legs, you have a bit of back discomfort, that means a disc problem. But fortunately, I don't think it's severe. It's early stages. So do some exercise. Start working out a little bit. Improve your muscle tone, inshallah. And how do you know that your core muscle is nice and strong? Is when you lay on your back again. Lift up. Both legs. Go up. And when you can do this without shaking like a leaf, like you're in an earthquake zone in Indonesia. So when you stop shaking, that means your cores are stable. Sometimes a weak core. Everyone has disc damage, nearly everyone, especially your generation. But it doesn't mean that you're going to have 100% slip disc. But if you're not careful, you will 100% have a slip disc. You either have a very, very early stage, which is not critical yet, okay, or you're about to have one. Okay? So, and how you defeat that is by improving your core muscles. Okay, your muscles hold your spine up. If the muscles are weak, the spine collapses. When you're already collapsed in a poor posture, it will damage the disc. He's got a little bit of back problem, but not so bad. Now, I cannot show adjustments or treatments because I do quite a bit of examination before I treat someone. But generally, most patients that have spinal problems, coming up so I can put this little guy here, our tiny model here. So a lot of times you see on YouTube that chiropractors twist the spine like this. Now, that type of chiropractic treatment, while it might be okay, I'm not a big fan of that. That technique is over 130 years old, which is fine. It's not that things back 130 years ago was horrible. No, they were good. But now we know a lot more than what we knew 130 years ago. So we know why that is good for certain instances. It's not good for a person that has disc damage or slip disc. Why? Because it twists the spine. The newer method, or using devices like these, it's not painful, and I'll demonstrate it on your hand. Very gentle. You could be a little kid, or an old man, or a tough guy. It doesn't matter. It is non-force, non-rotatory. So what I do with this, I typically, for patients like him, I would have him on their tummy, and I'll put some blocks. Like this. And now that Mr. Marcus has volunteered to come up here, I can use him as a volunteer. Can I have you lay on your tummy? Just a few minutes. Let me put this down. Actually, here, Mr. Marcus, hold on. What I would do it for him, but since I don't know which way to treat him and he's got a little bit of pain, I don't want to take a chance to do this for you, okay? But your assessment is not over. For him, I can do lift up. Lift up. These are positioned at different parts. I'm just doing it to show, not that he needs this specific format. The reason why I do this is because of the pelvis. Blocks are used specifically for the pelvis. These guys. One here, one here. So we lift them at different parts to decrease the stress on the spine. And the position where it's placed is specific to what happens in here. When we have issues in the spine, it affects everything above and everything below. One of the common things that every slip disc will have is a pelvic unleveling or instability, meaning the big hip bones, these two guys, not the two hip bones which is here, the iliums, the pelvises. The two pelvises rotate out of position, and that's important because those two pelvises form a very long joint with the very last bone in the spine, the tailbone, the sacrum and coccyx together. The sacrum actually, not the coccyx. Coccyx does not have a joint with the pelvis. So when the spine is out of alignment, the fourth lumbar and fifth lumbar, and there's this problem, there's going to be some rotational opposition. So we put these blocks in a manner that de-rotates it back to a healthier state, to relax the muscles. Then once the patient is in that position, this is the chiropractic, only the chiropractic part that I will do for slip disc. Can I have you hold this again, please? Thank you. Then we use an activator. Contact various points, and then stimulate. And then adjust. And I will show you, it's not painful. So basically I contact at a specific angle for a fifth lumbar here. And I will adjust 1 or 2 seconds. This technique allows me, this device is called an activator, first invented in the 60s. But since it has gone through many evolutions, and this is the latest one, it is a simple device, and it is an awesome because it does not use force, it uses high-speed velocity. Our aim in using this device is to redirect a joint, bone, muscle, tendon, or ligament back towards a state where they belong, or a position where they belong, to induce mobility in motion. But for slip discs, a lot of them are in a lot of pain. And for knee pain patients like her, like Doc, you are not going to have the ability to tolerate a lot of cracking and twisting on your knee. And some people will do that, but I will not do that. We use an instrument like this. This is just one tool. The other one is using a drop table or manual methods that are non-forceful. For the most part, contact different segments based on the angle, based on the joint of the ankle, or the knees, or the muscles of the thighs, because the hamstrings connect to the pelvis, which impacts the spine. Everything is connected. You know, there's a song, your hip bone is connected to your leg bone is connected to your... all the bones are connected. And all these connections are to muscles. When you have lower back problem, you'll have muscle problems here, muscle problems here, muscle problems here. The goal with the blocks is to stabilize the middle part, the pelvis. The aim with this is to realign, whether it's muscle or joint, and to mobilize, back to a better state. All right, sir, I'm going to lift this up. Thank you very much. And this is called the activator. It's utilized in the activator technique. These in chiropractic are called the SOT block, utilized specifically with the SOT technique in chiropractic. For slip disc, I'm using two techniques simultaneously. This with this. Why? Because the slip disc needs no force. In the traditional SOT technique in chiropractic, positioning of the blocks is identical to what I just showed you. And then the chiropractor comes in using his hands and delivers a thrust directly on the spine. Now that, for me, is a bit too forceful and non-specific, because my contact is not as small as this. I can be a lot more precise with this. And also, the force is preset. It doesn't matter how tired I am, how strong I feel, how mad I am, or how happy I am. The angle is always the same. The force is always the same. So I use two techniques, and that's my technique. This is what we do at our centers. Why do I use this? I have used all techniques. And as I said, where do you go? Oh, there, he's in the back. I was a year older than him that I had my bad back to the point that I couldn't even walk. He's not there. The reason why I use these techniques is because I have tried them all. Or I had all of them tried on me. And the one that helped me the most is this. Okay. Now, in chiropractic, as I said, positions, Mr. Marcus, you're here, come. We'll show the other techniques. Can I get you to be on your back? Take off your glasses, please. Face up. Oh yeah, a bit is big. Now, let your hold. Traditionally, when you go to a lot of these centers, whether chiropractic or physio or the tipped or kung fu master, you'll crack your neck, right? Crack your neck left. The kung fu master, like a lot of them that's on social media, on TikTok and Facebook, and have all kinds of videos there, stage videos. They are non-specific, they just grab the neck and twist it. Much like a martial art move, much like the kung fu move before killing the guy, stops. Cracking the neck. Does it work? Yes, it works for some people that have neck problems, on other people that have small neck problems, and makes them much worse. Okay. In chiropractic, it's similar to that, but a lot more specific. We don't just crack the neck. When we even use that technique, hold on, we use very specific contact points. You pull contact, and at a very specific angle, we deliver very gentle force. Now, the chiropractic adjustment is specific, but it's done with force, and the amount of twisting is almost none. But I didn't say none, I said almost none. All techniques, manual, has rotation. And if you have a disc problem, you do not want the slightest twisting or rotating, even if it's just a little. Okay. This is why all of these techniques for me is an honor. I've tried them. on myself. And I've tried the other ones, not auditory. Okay. Now, as far as the lower back is concerned, can I get you to be on your side? He's going to show on this side, facing me over here so the camera can see. Otherwise, my back will be towards the camera. The other one is where they get positioned. They get positioned like so. This is for the lower back, the manual method. This is also in chiropractic. This table is way too high for me to do this procedure. But typically, most non-specific methods that you will see, they will have the people's, and they're cranking and doing this. I call those guys idiots. They are disc making therapists. Okay? Don't ever try that. You know, but they say, but that feels good when I do that. Yeah, a lot of things feel good. The drug addicts do heroin and cocaine because it feels good. If life was all about feeling good, we will be doing that too. But don't chase feeling good. A lot of things feel good. Yes, if I crack him like a food, oh, that is nice. Yes, it's nice, but it damages the disc. And if I do it again and again, it can tear the disc apart. Now, but there is a way to do it that is safer. Okay? This is why, as I said, chiropractic came about 130 years ago. And chiropractors have done more research on manipulating the spinal joint than any other profession in history of humanity. Not just now, in history of humanity. So the chiropractic manipulation is highly focused, highly targeted. But as I said, it has rotation. So those techniques I don't use. I use when I know for a fact that that person does not have a damaged disc. Slightest doubt in my mind, I don't use. When in doubt, don't do it. I don't take chances with patients, but I will demonstrate on him without actually giving him the treatment on what a chiropractic version of the same cranking treatments that they do. Am I running out of time again? I have 10 minutes left. Okay. Come back in 5 minutes. So the other method in chiropractic, we have to identify where, tissue pull, contact, and trust. That already didn't you? I barely touched him, he already moved, but very gentle. Did you even think that I moved the spine? No. Ask him if it moved, it moved. Now, that is the chiropractic, it's not that crunch. But some chiropractors on YouTube do that. And those are the ones I call idiots, because that's not chiropractic. They're sensationalizing it. Proper chiropractic has to be specific, not on how loud the crack in the pop is. Okay. And if you happen to go to one that really wants to hear a loud crack, they're not treating you, they're traumatizing you. Okay. So treatment has to be very accurate, very proper. And it can be done on the knees. Typically, chiropractors, there's no manual, there's an old and outdated method from 130 years ago to treating the knees. I don't do that. Okay, we use the activator. Okay, so we realign. And the beautiful thing about the various techniques, as I said, that they're all good, they all have their places. But to me, the most versatile, the most effective is the activator because it's the latest one. And it also happens to be the one that a lot of the new data and research is being done on. And the reason why a lot of researchers prefer the activator, because it's the most reproducible technique there is. The force is set at where you want it to be. It's not based on my muscle mass. My force will be different than yours or yours or yours. But if I use an activator, it doesn't matter if it was me, it was you, the force can be exact, which is reproducible and duplicable, which is why a lot of researchers love it. And they're using it, and there's a lot of data that's coming out, and it's showing how effective it is actually. And to me, that is the best treatment for a slip disc. And unfortunately, I don't have any patients that I can treat you and show you this, but the chiropractic manipulation of the spine to realign it is a small part in the overall slip disc treatments. Unfortunately, I ran out of time. I talk too much and everything else, and sometimes I always, everywhere I go talk, they tell me I run out of time. Do I have 5 minutes left now? So you didn't come. I have 3 minutes left now. So, what? Now I lost my train of thought. Anyway, there's a lot more to slip disc than a chiropractic adjustment. There is no single treatment, and if anybody tells you I can fix you with one treatment, they're lying. If they can say that I can do this sit-tall move or this chiropractic adjustment, you will be perfectly fine. I do constant on you, you will miraculously recover. If I do this new wave thing, no. It's going to require work, not just on my part, but also on your part. And in order for it to get better, you have to do your part, or the patient has to do their part, and I have to do my part. My part is to design the treatments for you and to tell you what to do at home. Your part is to be here or to be at the center where I do the treatments for you and to do what you need to do at home. Usually, typically, for a disc like the person that we showed in here on one of the slides earlier that we had the disc reversed, we ended up doing 8 different procedures on him on each session. And one of those was chiropractic. There was also another chiropractic procedure called flexion distraction therapy. That's also chiropractic. So 2 out of 8 are chiropractic. 6 out of the 8 procedures that I do for patients that have a slip disc is physiotherapy. Okay. So this is why I say physiotherapy and chiropractic is like milk and honey. It goes together. And it has to be integrative. And not just for slip disc, but also for knee pain. It has to be. Physiotherapy by itself fails, so will chiropractic. Okay? But if you do properly, together, focus based on their condition, then it will work. And I'm sorry I went over it. Yes, I did. Thank you very much for having me. Thank you all for being here.
Assalamualaikum warahmatullahi wabarakatuh. If anyone has any questions that want to go over with me privately, I'll stick around for a few minutes and come talk to you. Because I realize some of you may not want to say anything.
The ceremony extended heartfelt thanks to Dr. Yamazafi and his team from the Chiropractic Specialty Center. We will now take a 5-minute break. Program will resume with an interactive quiz session. I now invite Mr. Ahmad Kashful Asfar and Mr. Muhammad Shazwan to lead the next segment. With great respect, I welcome them to the stage.
Yes. Thank you, our MC. Welcome to Help Quiz. I am your host, Kashful.
And I am Shazwan.
Okay, how's the sharing just now?
Is everything good?
Yes. Okay, now we will continue to a quizzes.
Okay, so now let's take a break and have some fun with a quiz to recap what we have learned today.
Yes, Shazwan. This quiz is to test your knowledge regarding what has been discussed and demonstrate just now.
So today we are focusing on a critical health topic, which is diabetes.
So there is 10 questions lined up after this. So, and the top 3 winner will get a prize.
Wait, is there really a prize for this quiz?
Yes, there is a prize for the top 3 winners.
So, are you all ready?
Are you guys ready? Okay, you guys can scan the QR code that have been shown at the front or enter the code 467136 to enter the quizzes. Those who watching on the YouTube channel can join the quizzes too. I repeat the code 476. Sorry, my bad. 476136. Okay. There is any students that want to join in?
Is everyone ready?
Okay, we have 10 seconds for you, those the audience and those who were on YouTube to enter the quizzes. So 10 seconds start from now. 10 8
7,
6
5,
4
3,
2
1.
10. Okay, let's start with our quiz.
For question 1, what is another term commonly used for a slipped disc? Osteoporosis, herniated disc, scoliosis, or back pain?
What is the answer? Okay, next question. Okay, let's see who's get the right answer. Kaweko. It's hard to pronounce the name, but the right answer is herniated disc.
Great job on that one. Now, question 2.
What is the name of this program? This is the bonus question for you all. If this stop, the heart stop recaps, is it scoliosis? What's that? Or the heart stop did this? Okay, Karawin is still on the top of the rank. Okay. Most of you again answer right. So let's next question.
Which part of the spine is most commonly affected by a slipped disc?
Is it cervical, lumbar,
or thoracic,
or sacral? Okay, the answer is lumbar. Okay, next question. Which symptom is commonly associated with a slipped disc? Okay. Saya ingatkan is number 1. Alright, and the correct answer is numbness or tingling in the limb. Okay.
what is the main cause of a slip disc?
Damia Christina, in the top of your hand right now. So the answer for this question is age-related wear and tear. Next questions. What medical conditions that have been discussed today? What is it slip disc? Is it recap?
Or is it scoliosis?
Okay, next question. Which imaging test is commonly used to diagnose a slip disc? First, X-ray, MRI, ultrasound, or PET scan. So what is the answer? Okay, halfway. Which type of specialist is our panelist for today's forums?
Cardiologist, or orthopedic doctor, or dermatologist, or
chiropractor.
Wow, Damia is still leading.
Okay, second last question. Which of the following is the recommended treatment for a mild slip disc?
Is it surgery, or physical therapy, or radiation therapy, or blood transfusion?
On to the last question.
Which of the following lifestyle can help prevent to slip disc? Is it smoking,
Poor posture,
regular exercise,
or skipping meals? Okay, Shazwan, let's see who's the winner. On the first rank is Damia. Okay. The right answer is regular exercise. And 54 of the audience answer right. Okay. I think that's all from us. But before that, for the winner, you can screenshots and contact our admin at the group for your prize. Thank you again for joining us today. I hope we hope to see you next again. So that's all for us. Thank you.
Thank you to Mr. Ahmad Kashful Asfal and Mr. Muhammad Shazwan for conducting the interactive quiz session just now. The ceremony will resume with the Advisor of Applied Science Youth Camp Group ASIC, Dr. Suzana binti Ratim, who will present a token of appreciation to our guest panelist, Dr. Yamazafe and his team. I respectfully invite Dr. Suzana binti Ratim and Dr. Yamazafi, together with his team from Chiropractic Community Center, to the stage. For graciously presenting the token of appreciation to Dr. Yamazafi and his team. As we approach the end of our program today, please remember to stand while singing the official university anthem of University Technology Mara, UiTM Hatiku. before we conclude, I invite everyone to remain standing and fill the center of photography for a photography session. Remains to show. For all you've given and you have been, your impact here is deep within. Honored guests, we have now concluded the Health Talk activities. Our heartfelt thanks to all who joined us today, especially our distinguished panelists who shared invaluable knowledge and insight. We hope today's session has enhanced our understanding of spinal health and motivated us all to adopt preventive measures for better physical well-being. Once again, we extend our deepest gratitude to our esteemed guests, strategic partner, Chiropractic Specialty Center, media partners, Sekretariat Mahasiswa Fakulti Sains Gunaan, Sekretariat Mahasiswa Fakulti Sains Kesihatan, Sekretariat Mahasiswa Fakulti Sukan Rekreasi, Sekretariat Mahasiswa Fakulti Perubatan, Bulan Sabit Merah UiTM Puncak Alam, Applied Science Association ASEP, Physiotherapy Student Association FITAS, College Mawa UiTM Shah Alam, College Betang and College Gamma of UiTM Tampak, faculty members of FSD, FSD staff, and UiTM students who made this program a success. With this, the event respectfully announced the exit of our VIPs and guests. Attention please. All attendees are requested to remain in the hall for the program feedback session. For the quizzes winners, the third place, Sahin Kashi, and the second place, Kivi, and the first one, Damya Christina. Please provide screenshot for your score and username to the admin of the WhatsApp group to claim your gift. To UiTM faculty, FSD staff, students, and all attendees, you are required to scan the QR code displayed on the screen. You will have 10 minutes to complete the feedback. Upon the completion of this feedback session, we officially conclude today's program. The organizing committee extends its deepest gratitude to all attendees for their presence and participation in the Health Talk activities. We look forward to seeing you again at a future event. Thank you. And with that, wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.